Hello, and welcome to today's informational webinar for Healthcare Excellence Canada's new program, Reimagining Long-Term Care, Enabling a Healthy Workforce to Provide Person-Centered Care. I'm so pleased to be joining you today as the host for this webinar. My name is Neil Dreimer. I'm the Director of the Health Innovation Programs here at HEC, and my pronouns are he and him. At HEC, we are on our own reconciliation journey, and I want to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I acknowledge that I am joining you from my home office in Ottawa, which is on the traditional and unceded territory of the Algonquin people. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. I invite you to also share who you are and where you're joining from in the chat box at the bottom of your screen. We are pleased to offer French simultaneous interpretation for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. We invite you to share your questions and comments at any point throughout the webinar in either of our official languages. If you have a comment, please put them in the chat box. And if you have a question for the host or HEC team, please add your question in the Q&A pod using the button at the bottom of your screen. We'll aim to address as many questions as we can during the Q&A session at the end of the webinar today. Also, just wanted to let you know, if you need support at any time throughout this webinar, you can reach out to our tech support using the chat feature. And also, this session is being recorded and we will be available on our website in the next couple of days to review and share with colleagues who may have missed it. So, joining me today, I'm so pleased that we have Dr. Sharon Strauss of St. Michael's Hospital and Billy Pratt of Eden Care Communities, who have been both involved in previous iterations of HEC's program supporting long-term care homes across Canada. And you'll hear from them later on to share their experiences. So, why are you here and what are we hoping to get out of today's webinar? So, one of our key points is we want to make sure we introduce you to our new program, give you an overview of the timeline, benefits, and commitments of the Reimagining Long-Term Care program. Of course, we also want to reflect the burning platform and challenges currently faced within the long-term care sector. And I'm sure many of you they'll be familiar to many of you, and also share some examples of how our organization's support in the long-term care space has led to positive changes. We want to make sure that by the end of this webinar, we can tell you why this program is important and what's in it for you and how it can support improvement in the long-term care space. As well, it'll be an opportunity for you to hear more about the online application process for reimagining long-term care and answering as many questions as you may have that time allows about applying for this program. So let's dig in. What is reimagining long-term care about? Ultimately, it's designed to help foster a more resilient long-term care sector by, number one, increasing capacity for safety and quality improvement work within long-term care. Also supporting homes to identify, plan, and implement changes that will enable a healthy workforce to deliver person-centered care to residents. This is also a great opportunity to foster peer-to-peer sharing and learning amongst the LTC sector and community across Canada. And ultimately, we hope this program helps people working in long-term care start to shift away from task-based care and focus more on the individual. So what's in it for you? Through reimagining long-term care, homes will be supported to develop and implement improvement work that builds better care with and for people living and working in LTC. Participating homes can receive up to $10,000 in funding and access to implementation and capacity building supports, which include monthly coaching hubs and expert-led webinars on a variety of topics related to long-term care. So, what do you need to do to get this support? Well, in order to get the most out of this program, we are asking that participants complete a project charter for their quality improvement initiative. And just to let you know, you'll have coaching support from HEC to guide you to refine this along the way, noting that this will be a living document that you can refer to and update along your improvement journey. We'll also require each participating home to report their expenditures, progress, and results and impact of their project throughout the program, including through the collection of select measures pertinent to your initiative to show the change that you are making. So in terms of timelines, the call has been open for about a week now, and we encourage you to apply before the deadline of November 4th, 2022. We aim to notify all applicants of the outcome of their application by the end of this calendar year, with the program set to begin in January. The program will run for 12 months, ending in December of 2023. And just a reminder, we're talking a lot about what the program is about, but if you have any questions that are starting to pop into your head, feel free to type them into the Q&A box at the bottom of your screen, and we'll come to these later on, and definitely continue to pop them in throughout the webinar. So we've told you a bit about what the program is, but what is the program responding to? We'd now like to discuss the current challenges and opportunity for positive change within long-term care and offer some concrete examples of ways that HEC and our partners have supported improvement in the sector throughout the last 3 years, and the pandemic. So it is now my pleasure to introduce our first speaker today, Dr. Sharon Strauss. Sharon is a geriatrician and clinical epidemiologist who trained at the University of Toronto and the University of Oxford. She is the director of the Knowledge Translation Program and physician-in-chief at St. Michael's Hospital and a professor in the Department of Medicine at U of T. She has received national awards for mentorship, research, and education, and she was inducted as a fellow in the Royal Society of Canada in November of 2021 and named as a member of the Order of Canada in December 2021. Sharon, over to you.
Great. Thanks so much, Neil. Thanks for the opportunity to come and speak to everybody about the amazing work that the HEC has done and all of our long-term care home partners. First slide, please. And next slide. So just to acknowledge that I'm based in Toronto, and in particular want to acknowledge that it's land that's been the traditional territory of many groups, and in particular that it's covered by Treaty 13 with the Mississaugas of the Credit and the Dish with One Spoon Treaty, which was amongst the Anishinaabe, the Mississaugas, and the Haudenosaunee. In particular, I acknowledge my position as a white settler and feel very grateful to live and work on this land, and in particular feel a responsibility to care for the land, and it's a commitment that my program adheres to as well. Next slide. So I'm speaking to you on behalf of an initiative that we launched a couple of years ago when the pandemic first started, and it was funded by a variety of groups, including the Public Health Agency of Canada as part of the COVID Immunity Task Force. And it was done in partnership with our colleagues from long-term care homes and retirement homes. And we partnered as well with HEC to try and facilitate access to the first iteration of HEC funding that was available for long-term care homes. And the Wellness Hub is an initiative that's based in Ontario, and it's really a co-created initiative with our partners in long-term care. to focus on supporting infection prevention and control, vaccine uptake, as well as the wellness of the staff, and also the wellness of the household members of the staff within the long-term care home sector. Next slide. So as I mentioned, it's co-created. So the ideas for what we do and all of the different implementation interventions come from everybody within the long-term care home sector. And it really responds to the needs. And initially at the very beginning of COVID, the focus was a little bit different from what it is right now as we're going into, really over 3 years almost. So one of the things that was an important partnership for this initiative was with HEC. And I wanted to acknowledge in particular the amazing leadership of Tanya McDonald, who led the first iteration, and then now with Neil taking it on, as well as the other members of the HEC. And we wanted to facilitate access to the HEC funds amongst the long-term care homes and work with the different long-term care homes on implementing their plans for use. This initially at the beginning of the pandemic focused on things like optimizing vaccine uptake and optimizing PPE. And then gradually over time, in particular over the last year and a half, has focused a lot on wellness and how do we support a well workforce and optimize kind of wraparound wellness resources. So the needs very much evolved over time. And so we saw people's use of the HEC resources evolve over time during the pandemic as well. Next slide, please. So in particular, I mentioned that there was a real focus over the last year on wellness. And so just as an example of some of the co-created resources that people have implemented using some of these HEC resources is implementing a wellness day. And it can be everything from, resources that are tailored to the site to creating access to different employee assistance programs, to supporting access to other resources that are really going to promote wellness amongst the staff. And in particular, I wanted to illustrate with the next slide that shows an example of a wellness day initiative that actually got some local media attention as well. So the next slide, please. So this was something that one of the partners within the Wellness Hub actually implemented using their HEC funds. So they decided to create a wellness room at the Idlewild home that focused on a place where people could actually go to when they're working to really have some downtime. And it was developed in partnership with the staff in that long-term care home setting. And it has really made an impact on their day-to-day wellness as well. And they've used this as a launching point then to develop additional wellness supports and resources. Next slide. One of the other things that was done as part of this initiative is creating this community of practice. And the sessions that are part of the Wellness Hub really focus on co-created sessions that respond to the needs of the staff in the long-term care homes. And in particular, one of the things that happened in the last few months is that people came together and wanted to share learnings around what did they find to be helpful in terms of supporting mental health and resilience amongst the staff to address things like moral injury, moral distress, burnout. And they created a bunch of different resources then that they were able to use that really shared their knowledge and shared their tips and strategies so that then they could take this back to their homes with them and implement these and really share them. So it really moved from beyond kind of this community of practice where everybody came together to discuss their experiences to really co-creating the different resources. And to address one of the things that came up, especially in the early days of the pandemic, that people felt maybe very isolated in particular settings and in particular homes, and being able to have access to others who were experiencing a lot of the same things and learn from each other and avoid duplication of effort. So if somebody had found something that was effective to be implemented, they could share it with others. And next slide. And I just wanted to acknowledge all of the amazing partners who work on Wellness Hub, in particular, as I mentioned, HEC, but there's more than 70 long-term care homes and retirement homes that are involved, and really wanted to thank all of them. They're an amazing group of people to work with, and I feel very, very fortunate to work with and learn from them. And in particular, being able to work with them now as we move forward to really focus on the next phases as we work through the pandemic challenges. So thank you very much.
Thank you so much, Sharon, for those wonderful examples and resources um, that have been developed that you shared. And really helpful, and it's really wonderful to see the impact that you've been able to affect together with your partners within long-term care. So now we will continue to dive deeper into practical examples of inspiring change ideas through the experience of the Eden Care Regina Lutheran Home. Eden Care Communities participated in HEC's most recent long-term care program, focused on quality improvement, and received support to design and begin to implement their innovative change idea. So I'd like to extend a warm welcome to Billy Pratt. Billy is the CEO for Eden Care Communities. He's an inspirational and transformational charity leader with a drive for excellence and inclusion that engages others in the pursuit of being better for the world. His professional and volunteer experiences come from international development, homelessness, community corrections, health, and social services. Thank you so much for joining today, Billy. Over to you.
Thank you very much, Neil. Thank you for having me here today. It's fantastic to be online with so many people across this country from coast to coast to coast. So to everyone who's on the call here today, hello, and hello to you. And I hope we have a good conversation today. First of all, I want to say the grant we received was amazing. We were only able to keep moving forward with quality improvement initiatives because of this funding. And I don't know what it's like. I'm going to guess that it's probably very similar for you right now in long-term care. Extra money for some of these really great initiatives is not always easy to come by. And the Healthcare Excellence Canada funding was tremendous. It's just it's allowed us to keep moving forward. So if you weren't planning to apply for this grant, make sure you apply, because it's very, very helpful. And the support we received from Healthcare Excellence Canada, as well as being part of the peer-to-peer support network across this country, has been exceptional. It's just, we're really lucky to be a part of it. So for us, like, what was the problem for us that we were trying to improve, the quality improvement issue? So just before this call for applications to come out, we had completed an all employee survey, and we looked at, how do we, trying to understand engagement and support that we could provide to employees. And this is night, of course, we're still in the pandemic now, but this was coming out of probably the heaviest part of the pandemic, that we've had to live so far. And there were three buckets of what I would call deficiencies that our employees were telling us. There was extreme tiredness, lack of appreciation, and lack of communication. Again, I know we're unique and special, or we're certainly special as an organization. I'm not sure if we were necessarily unique, and you're probably experiencing some of those things. So we wanted to help employees move from that pandemic workforce or workplace, which was very much a command and control. Let's get through today. Today was the day, to get to a more inclusive environment, that had more joy in the workplace and more hope in it as well. So the slide has come up on the screen in front of you. And so the inspiration for what we created. So on the left hand of your screen, you're going to see, I don't know if you can read it, but you see 4 buttons, and it says, please rate the cleanliness of our washroom. This comes from the Toronto Pearson International Airport. If you've ever been through there, they have these in the washrooms. And we thought, wow, what a simple concept, because the phrase quality improvement can be kind of daunting. And so we just wanted to know, how were people feeling? So we took that inspiration, and on the right-hand side of the slide in front of you, you're going to see 2 columns. One is what we would call the when I started my day, and then the second column on the furthest right of your slide is during my shift, I was. So we have a mobile app that all our employees use, and well, we thought they all use. So we'll get to that in a second in terms of things we've learned. So we encourage people to, when you arrive at work, how are you feeling? Are you happy? Are you unsure? Are you tired? Or are you frustrated? Are you sad? And of course, we also had a box at the bottom of this that just said, tell us more about why you chose the face you did. And because that's what we really want to get into, is understanding the why. So we did this, and we also added something what we called learning circles. That's a very kind of, some of you may have used this, but it's an opportunity to bring people together in a non-invasive and inclusive way to talk about things, because during the pandemic, as many of you have probably experienced, it's very difficult to have group meetings where you can, exchange food. So we had food at these learning circles, and we started the conversations about how's everybody doing, because we wanted to understand where we were so that we could make quality improvements to move us to that workplace that was, ultimately controlled by employees, owned by employees, and they felt joyfulness and hopefulness when they came to work. You can take the slide down if you like now, that's fine. So what worked well for us is when we went through all this, so we worked on this, I think it was about 8 months now, I think it was 7 or 8 months, I forget the exact number. Food matters. Food is really important, and particularly if you think for us, certainly pre-pandemic, food had always been the cornerstone, and in fact, any type of community engagement process, however you define community, food is critical to bringing people together. And so with us, we were able to bring food back into these conversations, and that was a big deal. So that worked really well. The learning circles, which is sort of the fancy name, the academic name, became conversations. The first ones were like very suspicious, why are we doing this? And then it moved towards, they became very much conversations, and people knew how they worked. And through that, we got a lot of really great insights about how to improve the quality of work that's going on and improving the workplace. And the third thing that worked well is that we made a very deliberate effort to include the night shift. So our leaders of this program would go into the night shift at night and talk to them about this program, because I think certainly at our place, and lots of times the night shift gets forgotten. And that was a huge win for us. What didn't work well for us? Well, we found out that not everyone is using the mobile app. We had used it throughout the whole pandemic, and it had been amazing, and we thought everyone was using it. And we found out there were some that weren't using it. So that was a good learning. We also had 3 outbreaks during this time when we were doing this quality improvement project. And during those outbreaks, that shifted things. That took the rhythm away. It also shifted how we could do our learning circles or our conversations, how we could engage with food. So, that is our reality right now. So we have to live with that. We're hoping these outbreaks will simmer down a bit now, and that will make it easier. And what also didn't work well, there was some distrust. I say some, not a lot, but some distrust of the mobile app. And we've been using this for 3 years now, and it's been amazing. There's been a lot of really great things, but we did learn that there were some employees who have distrust for it. So we were, so we'll work on that. So from the learnings, that means there's more to unpack. Where do we go to from here? And a few of the things we want to unpack out of this project is that whoever leads this project, it matters. I mean, it's all about, that person has to be neutral, mature. If they're a supervisor of a particular department within the home, they have to be mindful that they're leading the entire home and not just their people, and trying not to, it's part of leadership, right? You just want to have those open, authentic conversations. We heard from some employees who were still talking about issues from 10 years ago. I'm not making that up. And but again, that's an insight we would not have gotten or we've not been able to document without this grant. We also need to unpack this whole idea of quality improvement, that it takes time. This is not a 6-month fix. This is ongoing. It's arguably it's never ending, and sort of moving out of this pandemic command and control workplace is going to take some time. So we need to unpack that some more. Going with that, there's no quick fix. And of course, we also need to unpack patience. Those that are on our staff team that are leading this project are learning about patience, and we're unpacking that more with them, because this isn't a simple solution where you go in and you do A and we're going to get a B result. We're going to do A and then it's going to go to B and C, and we might get an H result. Like it's not necessarily linear, so it takes patience. So with that said, that's the overview, real fast whirlwind tour of what we did with the money we received. And I would just close by saying, what I said at the beginning, that with the support of Healthcare Excellence Canada, we have been able to improve and start moving down that pathway of quality improvement. And it's been exceptional. It's just been So I don't like to speak in with a negative word, but we would never have been able to do this without this funding. And that's going to make an impact. And it's just fantastic. So with that, I will stop and turn it back to you, Neil. Thanks very much.
Thanks so much, Billy, really for sharing really not only important story of change for Meet and Care, but some real world insights as to, you know, we always say improvement is not a linear process, and lots of things involved in perspectives, and you take 2 steps forward, 1 step back, but it sounds like it's been a really overall positive journey that you experienced in Eden Care, and really wonderful to just hear some of those lessons learned and nuggets that you've picked up along the way. So thanks again for sharing that inspiring example. So now that we've heard a little bit about some of the potential impacts that our HEC previous long-term care programs have had within the sector, we hope the benefits of enrollment in reimagining long-term care are now clear to you. So now we're going to actually go to the application process. And for those of you who are listening in and watching and who are considering applying for this new program, we're going to turn it over to my colleague, Kirby Kervin, who's going to give you an overview of the actual online process. And Kirby is a program lead at HEC on the Health Innovation Programs team. So over to you, Kirby.
Great. Thanks, Neil. And good morning, good afternoon to everybody. Thanks for joining us today. As mentioned, I'm Kirby Kervin, a program lead with the Reimagining LTC program here at HEC. And I'm coming to you from Chelsea, Quebec, which is in the heart of the Gatineau Hills on the unceded and unsurrendered territory of Algonquin peoples. And I just want to take a few minutes to introduce you to the application process for this program. So if you would like to apply for the Reimagining LTC program, you can find the application link on our Reimagining LTC website or directly using the web address you see at the top of the slide right now. And we will also put that into the chat box for you so you can check out the platform. So after clicking through the link to the Reimagining LTC program page, applicants will see the page that's shown here on the slide. Before clicking apply, we do want to make sure that you take the time to read through the information on the main page, which includes important notes about the program, including eligibility criteria and the deadline for the application, which is November 4th. Once you read through, just click apply to begin the application process. And you can see here, as mentioned, the closing date is November 4th. You can save your application and return to it later if needed, so it doesn't have to be done in one sitting. So next slide. Oh, actually, we're already on the next slide, so that's perfect. So if you have not used Survey Apply before, which is the program that we're using to accept applications, you'll first be asked to create a Survey Apply account with your email address, and then move to the first step of the application, which is the eligibility form. So you can see that's highlighted in yellow. You'll need to click on the eligibility form to actually start that process. So we'll go to the next slide, please. And once the eligibility form is complete and submitted, you will then receive an email notifying you if you are indeed eligible to move ahead with the application. So the eligibility form is really only a few short questions that ensure that you are indeed an LTC home in Canada and that you have support from your organization to proceed with an application. When you receive the email stating that you're eligible, you can then go back into Survey Apply and begin the application form. So you'll see your completed eligibility form is previewed on the right side of the screen, and the highlighted application link is on the left. So simply click to begin completing the application form. So whenever you have a task to complete throughout the application process, you will be notified by email, and you simply need to sign into Survey Apply, and you'll see the assigned task on the left-hand side. So perfect. Next slide. You guys are so efficient. After clicking application on the left side of the screen, you will be taken to the start of the full program application. The highlighted portion is the progress bar, which indicates how much of the application is completed and saved so far. So once you've completed the full application, you'll need to click submit, and your application will then be reviewed by our team internally here at HEC, and you will receive a response via email once a decision has been made in terms of whether you'll be accepted into the program or not. So if you're accepted, you'll receive an email notifying you this and providing additional details about the program and deliverables. You'll be tasked with coming back into the portal again to formally accept entrance. And that by doing that, you're going to trigger the development of your collaborative agreement. If you're accepted, but with conditions, you'll receive an email notifying the conditions required. So perhaps there's some minor changes we're looking for you to make in your application around budget or around team membership. So your application will be reopened in the portal, and you'll be asked to go back into your application and make the necessary changes and updates based on the conditions you receive, and then resubmit. We'll review and signing of your agreement will be done within the Survey Apply portal as well. So once that's completed as a task, a PDF copy of the agreement, the final agreement, will be emailed to you. If your application is not accepted, you will also receive an email from HEC notifying you. As always, for the application process, we're here to help any teams that require support as they go through the application process. And we've already been communicating with a number of interested organizations around the application. So if at any time you have questions, you can reach out to us at our LTC-SLD email, and we'll help you through that process. And again, as Neil mentioned, if you have any questions about the application, the requirements, eligibility while we're on the call today, just remember to throw that into the Q&A chat, and we will make sure to address those on today's call. So I'm going to turn it over to Neil again to provide some additional information on what we're looking for in the actual application around your proposed project. Back to you, Neil.
Thanks so much, Kirby. And to really start for that very practical walking through the application process. And we've tried to hopefully make it as simple as possible. But again, definitely connect today or after the webinar if there's questions. So, and we also, to let you know, we did post the application link in the chat box. So if you want to even go there as we're speaking, you can at least visit and see what it looks like. So just to delve a bit deeper into the overall application, once you're there, you'll find a section asking you to detail a quality improvement project that your home will focus on throughout the Reimagining Long-Term Care program. You'll also need to provide a budget outlining the costs associated with creating and implementing this improvement project. There are overall 5 application questions that you'll need to answer related to the project. And let's go through each of them now, one at a time. So the first one is, describe the issue your proposed project would be addressing, and draw on any data gathered to help you document your problem. What is the reason you want to address this problem right now? So what are our tips for you in answering this question? So when you're designing your initiative, or at least the idea for your initiative, we encourage applicants to align the project with any of the following focus areas. And there's 4. A healthy, competent workforce. B, team-based approaches to person-centered care. C, meaningful quality of life for residents. And the last one, high quality care based on the life experiences, needs, and preferences of residents. Within these focus areas, we're hoping to see teams describe their burning platform or challenge by sharing any documented evidence they have that has led them to identify why they want to tackle this particular issue within their home. Related to this, we did want to mention that the Health Standards Organization's new National Long-Term Care Services Standard is set to be published in January of 2023. This standard will address the delivery of safe, reliable, and high-quality long-term care services. Key areas of the standard include some of the things we just mentioned, those 4 areas, including promoting resident-centered care and enabling a healthy, safe, and competent long-term care workforce. And of course, these align very closely with the focus of our program. So given this, we want you to keep in mind that this new LTC services standard will be a great tool to support quality improvement within your home, including those that are participating in our program. And by participating in our program, not only will you be making positive changes for the residents and staff in your home, but also you may be moving your home towards aligning with aspects of this new national standard. So really, we just wanted to highlight it. It would be a win-win for your home. So the next question really is talking about describe your proposed initiative and how it'll address the main themes of this program, which really come down to people in the workforce and person-centered care. What will improve, by when, and by how much? So in response to this question, applicants will need to consider the intended outcomes of their project and whether their proposed project is feasible with regards to the resources, timelines, and level of impact needed. I did want to note that, when we talk about what will improve by when, by how much, this is obviously only a target because you won't have started your initiative. But in quality improvement, it really is important to set those measurable targets up front. Because if you just, you're not starting with something measurable to begin with, then it's hard to know if you're actually making progress. The other key point I want to make here is I really want to encourage people to start small versus thinking about large scale change. And this is really in alignment with the overall quality improvement philosophy. Remember, you need to test the changes that you're making. So you don't want to implement something all at once and then only at the end see if it's working. You want to start small, start with one resident, one process change, one day at a time, and then keep refining it. The third question that we're asking you to consider when you're applying is, how will you know that a change is an improvement? So we want you to describe what you are already measuring or planning to measure that will inform the project. What change ideas can you test within the 12-month program to improve care? So again, this speaks to that whole theme of measurement. All applications will need to consider how the change that you are implementing will be measured throughout your initiative, including and hopefully using data that you already collect within the home and any new indicators or measures that you'll need to be captured within the 12-month timeframe of this program. Again, here, I want to reiterate, I encourage you to start small with just a small number of measures versus a long list, hopefully using things that are simple to collect already. For example, I know almost every home is using the RIE tool. So is there any measures that are already being collected there that can help you measure the impact of the change that you're making? The next question is select your organization's current use of data to support quality improvement priorities and planning. So here, we just want to get a sense from you and your home. What is your degree of comfort with using data for quality improvement? You can really just reflect whether it's high, some degree, or no comfort. And if you have any examples of using data for improvement, that would be great. And the last question that we're hoping that you'll answer or begin to answer in the application is, what measurable improvements do you expect to see from your initiative over the 12 months? And what improvements do you hope to see beyond the 12-month program? So here we're asking you to envision what changes you believe will be seen with your organization or home at the end of the program, for residents, for their families and essential care partners, for staff and management. And again, you could choose where you want to focus, but those are some of the people you might want to consider. And again, this is where the targets come into play. What is a realistic target in terms of the improvements you want to see? And I'll say this one more time, start small. So that's really it in terms of the application process, but I did want to just share a few other examples of previous change ideas that HEC has supported from our most recent quality improvement program. One was a home in British Columbia endeavored to address workplace violence by promoting components of person-centered care through a compassionate, team-based approach. They aim to respond by increasing clinical education support and individualizing assessments and care plans. So this really is looking at the issue of workplace violence and through clinical education support and care plans. Another home in Ontario sought to deliver high quality dementia care based on the individual experiences, needs, and preferences of residents, ultimately enabling a higher quality of life. They looked to best practices and invited all homes within their network to learn together through a community of practice approach. So really focusing on those individual needs and who the residents are as people to determine their approach. And finally, the last example I want to share is a home in a northern community sought to enable a healthy and competent workforce that could provide high quality care, even in challenging times. Their plan included regularly checking in, measuring, and responding to working conditions in real time through solutions that were co-designed for with staff. And this is, I think, aligns with some of the things that Billy was mentioning, how it's really important to co-design with the people who are working in the home with you as to the best solutions and what's feasible and realistic and will make the biggest difference. So with that, we now have an opportunity to take on any questions that have popped into your head as we spoke about the program. We'll answer as many as we can, and if we don't know the answer, we'll make sure to share following the presentation. But again, if there are things that are questions that you haven't typed in already, I invite you to do that using the Q&A button on the bottom of your screen. So let's start with some of the questions we received here. So why is this opportunity only offered to long-term care and not retirement homes as well? It's a great question. And ultimately, I did want to mention that our webinar series is actually public facing. So anybody from any sector can attend and participate in those webinars. So that is definitely an opportunity that is not limited to participants in this program. And there's a lot of, I imagine there will continue to be a lot of relevant information and knowledge sharing that would be useful for folks across the health sector and beyond. But ultimately, some of our past programs, the first one was more of a pandemic emergency response for older adults in any congregate setting. So that's where we were able to support homes from both the retirement home and long-term care space. But then with the shift towards quality improvement in our long-term care quality improvement program, we had to focus on one specific sector. Ultimately, we do have limited funding, so that's unfortunately part of the reality, but definitely we'll keep this in mind as we design future programs. The next question that I see here is, do we need the whole charter defined in order to apply? And so the short answer is no. What we're looking for is just the beginning of a project proposal idea and direction. We know, and I mean, having participated in quality improvement initiatives in the past, things will change, and ultimately we want to use it as a living document and resource. So I just went over some of the questions that we're hoping that you'll answer, but we know that things will shift and change as you start going deeper. And you'll also, those homes that are invited to participate in the program will have coaching opportunities to help you complete and refine your charter at the beginning of the program. So we definitely don't expect a finished, polished product. It's just to start to note down the ideas to give you some direction. The next question we have here is, we have 5 connected homes. Would each one get separate funding, i.e. access to up to $10,000? Does each home need to apply separately? So the short answer is yes, each home needs to apply individually, and each will have access for up to $10,000 of funding per home. And probably a similar question for multi-site organizations. Can we submit multiple applications for different projects for individual homes or teams? Homes may only apply once per site with one project per site. So if there are multiple sites within your larger organization, we encourage you to apply individually. And so each home can have their own separate project, and they would be eligible for up to $10,000 in seed funding. This one is around the application form. Is there a PDF available of the application form that could be shared? So I was told that you can't apply using a PDF, since the system is set up to have you do everything on the application portal. You do, however, have the ability to download a PDF copy of the application from the portal if you want to refer to it, but you will need to submit the application using the online application portal. So yeah, I think you can definitely download the application, but ultimately you'll have to submit the application through the portal. Is there a maximum number of homes that will be accepting? So right now we have funding for approximately 200 homes to participate in this program. So that's kind of our sort of limit at this point in time. Having said that, there might be future programs. We don't know the answer at this point in time. So I would encourage everybody to apply, and then for whatever reason, if we reach that maximum, there might be future opportunities. But having said that, we also want to encourage homes to apply earlier in the process, which will simplify our own determination who we can invite in. So the deadline is November 4th, but definitely encourage you to apply earlier in the process if you're able to. Is one individual able to apply on behalf of multiple separate homes? So each home needs to apply individually and will have access to up to $10,000 of funding. And so there's nothing stopping from one individual to apply for 5 different homes, but we would expect there to be some variation between each application because each home will be a bit different. But it has to be a separate application process for each home. Can we apply for a project that is an extension of a previous project funded by HEC? We anticipated this question. So yes, we know that that some homes might already be participating in the current long-term care QI program. And so we do encourage teams who already have a QI initiative underway to consider how they can continue to build and refine this work in this new program. So absolutely, we encourage you to apply even if you've already participated or are participating in the current LTC program. And I'm just reading some of the other questions that we haven't answered yet. Are the previously funded projects on our website? So I think right now we don't necessarily, because the current LTC QI program and Tanya McDonald and her great team are supporting, that program is still being run right now. And I think it's set to close off soon. So I imagine in the future, we will be sharing some of those previously funded projects, but right now, I don't believe there is that information yet, but I'll see if we can get clarity even after this call on that. Could a person apply on behalf of multiple homes under one account if they're working different sites but only have one email address? So yes, I think this was a similar question to the one before. Yes, you can use one email for multiple homes as long as there's a site lead for each site and reporting is filed by site. So we still ask that there is a site lead on site for every site, and that the reporting that we're asking at multiple points throughout the program is on a site basis, not on an organization basis. Wow, there's lots of questions. I'm doing my best here. What if a recipient has won an application before? And I do want to stress, it's not a contest. It's just really more in terms of readiness. But I get your point. If you've received funding and support before, are they still eligible? And the short answer is yes. Can I confirm this whole focus is on person-centered care, resident QI, or is this more towards the employee wellness, or as it seems there is a focus on the employee? So yeah, I mean, it's a great question. Our focus is really on supporting the long-term care workforce to be able to provide person-centered care. So our philosophy is that both workforce resiliency and person-centered care are linked, and this program will support both areas. So, I mean, that's definitely our goal. If you want to place more emphasis on, the workforce, for example, and reflecting how ultimately, even if it's beyond the 12 months of this program, that you can see the connection to how it will enable person-centered care, that's fine as well. We know, again, with my focus on, or my suggestion to start small, we know homes can't do everything all at once. So just as long as we see a link that if you are, for example, working on a workforce initiative, ultimately you can see how it would benefit the resident down the road, even if it's not immediate. So, I can see my great team who is typing out answers as we to some of these other questions. So do you have some other examples of what homes have specifically utilized the funds for? So in the past, and I think within the application, we describe sort of what is the categories or the what is eligible, what can you use it for, and what you shouldn't use it for. And that again is when you submit a budget, we'll be looking at that. So in the past, previous participants have used funds to provide education and training, to backfill staff. So we know that there's not a lot. Staffing is a concern. So we're hoping that some of the funding, if it would support your initiative, could allow a dedicated staff to attend the sessions, so that and to backfill their time. You can also use it to purchase necessary materials and equipment that would support your implementation of your project, and hiring consultants or experts in training, or for example, mental health, wellness, and therapy. The last question, and I think we'll have time for, but again, if we don't get to your question today, still encourage you to type in the questions, because we will be sharing materials from the webinar in the next few days. So we'll try and reflect answers to unanswered questions there. Could a third party apply on behalf of a home if they are a stakeholder but not an employee? For example, a project manager or consultant delivering services on a project. So the answer is, if a home is working directly with a third party, they are welcome to complete an application on behalf of a home. That being said, we're still going to require a clearly identified site lead, so somebody who works at the home, as well as senior leadership support. We want to make sure that we have your home's senior leadership support to clearly delineated within the application. And so I think the last one I'm going to try and answer: what are the frequency of coaching sessions if accepted? And outside of coaching sessions, are there other hubs available for organizations who are working on a project to connect, share, and learn with each other? So I think there's going to be dedicated time and expectations that accepted homes will attend monthly coaching sessions. And I think we are still looking at how we can support homes to connect with each other, even beyond the defined coaching sessions. But we definitely, I mean, that's a goal of this program. We want to build that community and that peer-to-peer sharings, and we really hope that this will allow that. And I would say all homes from all across Canada are eligible to apply. So I think we're getting short on time. So I did want to just say thank you to each and every one of you for just participating, listening in, and sharing all of your questions. I also want to send a warm round of gratitude to Sharon and Billy for sharing their ideas or their stories, actually, of successful changes within the long-term care sector. And again, we want to thank you all for joining as we launch the call for applications. Again, whether you've participated previously in our programming or are new, we encourage you to consider applying. And please don't hesitate to contact us at the email on the screen if you have any questions along the way. Last thing we're going to ask of you, we really appreciate your feedback to let us know if you thought this session was helpful to you. So we'll now ask you to please take a moment to complete the polling questions that you'll see on your screen now. And the poll questions are: the webinar provided useful information. I intend to share what I learned with others. I know more about this topic than I did before. Does your long-term care home. There we go. Intend to apply. And due to our Health Canada requirements, we are also asking you to identify your gender, or you can indicate prefer not to disclose. So we look forward to receiving applications from you all across the country and encourage you to also spread the word. And once again, thank you everyone today for supporting this new program. Have a great rest of your day.